going to. I have two slides, one on sort of some ideas and research for marketing, and another one in data sources. So the first slide, next slide.
Yep.
Yes, thanks. So one thing that's going on in healthcare is a lot of dynamics. Things are changing. I've always found it's interesting to focus research on change, what's new and what's different from yesterday, and trying to understand why it's different and how to deal with it. One of the things is the service mix. The service mix in healthcare is really an interesting mix. It's similar to the product line problem, deciding what products in your line, except there's some generic differences because it's in healthcare. One is, for example, if you have a level 3 trauma center, you can deal with level 2 problems. But if you have a level 2 trauma center, you can't deal with level 3 problems. And so the product lines have certain characteristics which are interesting in healthcare. In a recent paper in JMR, we were looking at the difference between the service mix of nonprofit versus for-profit. And we found dramatic differences in what services the nonprofit hospitals offered versus the for-profit hospitals. And that accounted for why the nonprofits are so much more profitable than the for-profit hospitals. It was basically their service mix which explained that. So that's an interesting area of research, is what services they actually offer. In medical services, you can add physicians to your partnership and or your office and or not. And so the question is which, and things are becoming very specialized, so there's a constant change in what service mix people are offering. Another is that the websites in the service area tend to be educational in nature or selling. So most websites are usually educational, trying to explain, provide diagnostics or possible treatments for various remedies. But right now, what they're doing is trying to integrate the selling with the education. And so at the end of the website, not only will they provide information, but they'll provide referrals to various services that might help in that treatment plan. So and I think that's sort of something new, is this combination of selling and education on the website and how to deal with that integration. Another interesting issue is the launching of new products, particularly new medical devices, and there's hundreds of those. By the way, the cost of medical devices is dropping dramatically. They're going way down. The reason the average cost is going up is because the new devices coming on the market cost more. And so if you actually look at the old devices, the prices have dropped dramatically. It's just the new devices on average are so high that they bring up the average cost of medical devices. And part of the problem is launching them involves so many people. I was involved in one manufacturer, is a patent litigation case, and they had a tremendous sales force, and they were selling this product everywhere as a product for the heart, and the product was saving lives. And then they were sued for patent infringement by a company who had developed a similar device, but they weren't able to market it. And so the judge, usually the remedy would be you'd stop the infringer from, the judge said, we can't stop the infringer here because they're saving all these devices. And the marketing is what made the difference. They couldn't bring the device to market. They actually developed it, but the people that developed that could bring it to market didn't have the patent for it, or at least that was what the court ruled. And so marketing tended to be sort of saved a lot of lives in that case, and as they say, they forced the licensing agreement in that case. Another interesting issue is blockchain. John Lynch talked about this dissemination of data. What blockchain is where you have not one central database, but lots of databases that are linked. And so everybody can access other people's computers and data on that. And that's sort of taking over in a lot of areas where people have to share information. And this is really a nightmare in healthcare because of the privacy concerns and all the laws concerning privacy. But blockchain is here to stay. I mean, that's the new decentralized type of database. Artificial intelligence is also coming into play, where people are interacting with websites to diagnose particular problems they're having and look at possible treatment plans. And that interface is really marketing, of how you interface the artificial intelligence with the consumers. Government regulations, people have already talked about that, so I'm not going to dwell on that. But let me point out that what I'm aware of is that regulators have a hard time talking with companies because of conflicts of interest. And one of the things academics can do is hold conferences where they can talk to each other. And this has happened in other regulatory areas where academics have conferences that bring together industry and regulators where they couldn't find a neutral ground to talk otherwise, which would be legal for them to do so. For-profit entry is very interesting. There's three types of entities in healthcare. There's public, there's private nonprofit, and public for-profit. Let me just quickly go to the next slide. On the next slide, I have sort of data sources. Let me just point out that there's lots of data that's available, and we found that it's not that hard to integrate these databases if you do it by geography. It's like, for example, you can take 3 different databases, integrate it by state, or you can integrate by zip code, or what the government uses is FIPS. And if you integrate the databases using that, it's not that hard to combine the different databases together, and that's what we did in the hospital paper in JMR. We used the American Hospital Directory data set with bureau label statistics and some of these other data sets using zip codes.